If you're still typing clinical notes, patient and doctor emails, and long reports after seeing patients, there is a better way. Let me show you how HearScribe transforms a summary of a 30-minute consultation into professional notes in seconds. It would work the same for an actual consultation. We began by performing otoscopic examination using a video otoscope. This revealed bilateral cerumen impaction, though the blockages were incomplete. Both external auditory canals were subsequently cleared via microsuction under direct visualization with an ENT operating microscope. The procedure was efficient, and both canals were successfully cleared. Mild erythema of the canal walls was noted, for which we advised the use of almond oil as an emollient aftercare measure. This is available for purchase at reception. Considering Mrs. Robinson's reported symptoms of bilateral hearing loss and tinnitus, along with the fact that the cerumen was not fully occluding her external auditory canals, we proceeded with further audiological assessment. Pure tone screening demonstrated a flat bilateral conductive hearing loss. Tympanometry produced type B traces bilaterally, consistent with middle ear effusion, indicating otitis media with effusion. We prescribed the use of an Otivent nasal balloon autoinflation device twice daily. We also advised that some patients have reported additional benefit from over-the-counter oral decongestants. As the hearing loss and tinnitus have been persistent for over 3 weeks, we are referring her to her GP for further medical evaluation. Should the effusion resolve within the next few weeks and hearing thresholds return to baseline, no further intervention will be required. However, if hearing improvement is only partial or symptoms persist, she should return both to her GP and to us for a comprehensive audiological consultation. Finally, we recommended routine follow-up for cerumen management with an earwax checkup in 12 months' time. Perfect. Recording stopped, and we've captured everything from that consultation. Now watch how HearScribe transforms this raw transcription into professional documentation. One click on Generate Notes, and HearScribe gets to work, creating 4 different document types simultaneously. Here we have your clinical documentation, the comprehensive notes you need for patient records. Notice how it's automatically structured with patient information, presenting complaint, history, examination findings, assessment, and follow-up plan. What's brilliant here is that this adapts to your practice style. In your account settings, you can choose between detailed documentation, concise bullet points, SOAP format, or whatever works for you. You can even add custom instructions. Maybe you always want tympanometry results included, or specific terminology for insurance purposes. We've trained HearScribe to capture the clinical terminology correctly. Otoscopy findings, cerumen impaction, conductive component, all the professional language you'd expect. This isn't generic text. It's proper clinical documentation that meets audiology professional standards. Now the patient email notes. Completely different tone and purpose. These are written directly to your patient in clear, friendly language they'll actually understand and appreciate. No medical jargon unless it's explained. It's automatically added your clinic details, booking links, even your Google review URL if you've set that up in your profile. You can customize whether these notes are conversational, simplified for elderly patients, or action-focused for busy professionals. The beauty is, your patient walks out with clear instructions they can refer to at home. It's all here. This dramatically reduces those follow-up phone calls asking for clarification, and it shows exceptional patient care. They're getting professional documentation immediately, not a scribbled note or nothing at all. HearScribe generates administrative gold for you and your reception team. Everything that needs doing after every appointment, formatted as a clear action list, book follow-ups, order demo aids, send a repair, insurance claims. Your team knows exactly what needs doing without missing a detail ever again. Now for the GP letter or professional report if you're sending to ENT or another specialist. Look at the formatting. Proper medical correspondence with your letterhead details automatically included from your profile. It's formal, comprehensive, includes relevant clinical findings, and clear recommendations. You control the style here too. Some GPs want brief summaries. Others need detailed reports. Maybe you're writing to an ENT consultant who wants specific acoustic reflex data included. Set it once in your preferences, and every letter follows your requirements. What used to take 15 to 20 minutes of typing after each patient is now done instantly, and it's not a template where you're filling blanks. It's specifically written based on what actually happened in this consultation. The Save for Later button downloads everything as a text file. Patient notes, clinical documentation, the transcript, all of it. Perfect for when you haven't got the time to review the notes between patients. You can also share with a colleague for a second opinion, or simply keep as backup. Some clinics save these in their entirety to their practice management system. The important thing is nothing's lost when you close this window or start recording another consultation. Next patient clears everything ready for your next consultation. And yes, that warning's there because we don't store any patient data. Once you click this, it's gone unless you've saved it for later. That's HearScribe. From recording to complete documentation in seconds, not hours. Start your free trial at hearscribe.com and be brilliant with HearScribe, your notes reinvented.